Namaskar, good evening, and warm greetings from India. Warm greetings to all my listeners, my friends, colleagues, teachers, and all my well wishers. I'm Dr. Tapaswini Pradhan, and I work as a head and neck oncosurgeon in the Department of Surgical Oncology at the Fortis Hospital, Shalimar Bagh, Delhi. At the outset, I want to thank the founder of Shreshth Sangam, Ms. Mehak Chawla, who's a famous choreographer and a Bharatanatyam exponent, and also the chief coordinator, Hemant Joshi, for giving me this platform today. I've been listening to the various lectures conducted by the organization with experts from different parts of the world, and they've been really informative. It's also been a lovely experience watching and listening to young artists, musicians, dancers, and one realizes our country has enormous talent in every field. Thanks once again, Hemantji and Mehakji, and hope we'll continue to do many more programs in the future. Well, I thought of penning down a couple of facts pertaining to COVID-19 virus and deliberate to you all from a doctor's perspective. This 120 micron sized organism has thrown the entire world to a halt and has put lives and livelihoods at stake. So the pandemic has come to all of us with a huge price tag, slumping the entire economy of the world, putting everybody's future into uncertainty. So viruses can be very aptly described as the most political of all creatures. They have brought down empires faster than human revolutions and have been true weapons of mass destruction. Let's peep into our history. Now, if you go back to the history, we'll realize how devastating pandemics have been. Look at the H1N1 influenza virus, which caused the Spanish flu of 1918, struck the Kansas City of USA. It spread like a wildfire, and in a period of 2 years, it had caused a mortality figure of 39 million, which was much more than the cumulative effect of the two world wars, 1 and 2. It spanned over 10 years. So is the history repeating itself again? According to the WHO, it is the first pandemic due to the coronavirus and is going to be the worst and the most dangerous threat to the world's public health. Well, on one side of the coin is the grim side of the story, but the other side of the same coin is just amazing. Haven't you appreciated the change in the entire urban landscape? One can actually see nature adorned immaculately in its various colors. The Yamuna and the Ganges look much cleaner. They have attracted the original flora and the fauna. The animals around us must be experiencing a great sense of respite due to non-interference by humans. We as individuals can perceptibly feel the morning freshness. Life definitely has slowed down, but certainly for our betterment. That's the silver lining in the entire downturn. Remember Ghalib's poetry? गुजर जाएगा ये दौर भी गालिब, जरा इत्मीनान तो रख, जब खुशी ही नहीं रही, जब खुशी ही नहीं ठहरी, तो गम की क्या औकात है? So friends, nothing in life is permanent. No matter how bad the situation may be, it will change. So let's remain positive. Let's look at the epidemiology of these viruses. Now, there's been a prediction from one of the most famous epidemiologists from Harvard University, Dr. Mark Lipschitz. According to his prediction, at the end of this pandemic, there may be small outbreaks every season, or it may disappear but to reappear in the 2025 year again. The fact that we all of us should be aware of is any virus which enters from animals to humans takes hundreds of years to go. Look at the polio virus. It took around 400 years to be eradicated from most parts of the world. The same smallpox virus, which is not heard of anymore. But measles, influenza, chickenpox continue to exist in spite of the immunization and the vaccination. So there is no doubt that this virus will plague us for years now, vaccine or no vaccine. But there are constant warnings from nature which mankind refuses to heed to. So it's high time that we introspect. If we continue with the process of global warming, trading practices, animal trading, and extensive air travels, this will be a beautiful recipe for another future pandemic disaster. Let's know something about this virus that we are talking about today. Now, the story of the coronavirus begins with Dr. David Arthur Tyrrell. He is a famous British virologist who studied the virus of common cold, but he did a brilliant work which laid the groundwork for modern research on these coronaviruses. Now, if you look at the coronavirus, it's classified into alpha, beta, gamma, and the delta. The alpha and the beta are the ones which actually infect the human beings and some mammals, especially the bats, while the gamma and the delta only confine themselves to the birds. There are 7 strains of coronaviruses which infect humans, and therefore they are known as human coronaviruses. 4 of its strain are harmless, but the remaining 3 are dangerous, causing SARS, MERS, and the ongoing COVID-19 pandemic. So this COVID-19 strain is said to have a genetic affinity with the SARS-CoV-1 to a tune of around 79% and with MERS-CoV to a tune of around 50%. Now, if we compare the 3 viruses, COVID-19 is more infectious. In fact, it is doubly infectious than what it was thought to be. One individual can infect 5.7 people and can pass on to the other person in a span of 2.3 to 3.3 days. As of now, we have no idea about the seasonality of the virus. So thinking aloud that the virus may go away with the summer setting in may be a wishful thinking. Let's look into the incubation period of the virus, and I'm going to explain you what does the word incubation period scientifically imply. Now, the incubation period of these viruses lasts for around 5 to 6 days, but it can have a range of 1 to 14 days, but can extend up to 24 days, which means the time period the virus enters the human body to the time frame that it takes to manifest symptoms is what we call as the incubation period. So when the incubation period is long, as what we see in coronaviruses, it is risky because during this period, the patient unknowingly would be infecting many more individuals. Now, what are the signs and symptoms that we should be all aware of? 60 to 80%, that's an alarming figure, are asymptomatic, which in other words means that this individual unknowingly will be harboring the disease and would be infecting many more people around. When symptoms do appear, they appear on the 11th to the 12th day, and most of the symptoms are in the form of fever, cough, muscular aches, and breathlessness. Unlike the other flu viruses which present as nasal blockade, sneezing, and sore throat. The other atypical manifestations which these viruses can have is loss of smell, loss of taste, rashes in the lower limb, convulsions, loss of consciousness, headache, abdominal pain, and diarrhea. So when the symptoms do appear, we realize 80% of the symptoms are mild. It's only 20% of the patients who would have severe symptoms. So 20% which have severe symptoms do require hospitalization, out of which 5% require ICU care. So the mild symptoms tend to recover within a period of 2 to 3 weeks, but the severe symptoms may take around 6 to 8 weeks. Look at the mortality caused by these viruses. We compare the COVID-19 with its cousins, that's the SARS-CoV-1 and the MERS virus. The mortality because of the SARS is to the tune of 9.6, while of MERS, which is the Middle East respiratory symptom, it caused around 34.4% mortality. With COVID-19, it is low, it is around 3 to 4%. But please remember, if you look at the elderlies, the mortality can be as high as around 18 to 20%. So to be more explicit, the mortality in patients above 60 years is nearly 4 times higher, while those who are above 70 years, it is 12 times higher. Besides old age, patients who have comorbidities like hypertension, diabetes, cardiovascular diseases, chronic lung diseases, and cancers have disease manifestations in the severe form with fatal consequences. Cancer patients have almost a 2-fold higher risk of contracting COVID, and the mortality in these patients can be to the tune of 40% vis-a-vis 8% in a general population. These deaths are actually seen around the 2nd to the 3rd week, and the cause of the death in high chunk of the patients is respiratory failure. Some do die of cardiac issues, heart issues, and some die of combination of respiratory and cardiac problems. Now, what's unique about this virus? Now, typical about this virus is that it can combine with any virus which is not even identical to the coronavirus. So what happens is that it combines with another virus of a different family and a different species, and the recombination can be really deadly, and that is what we fear can happen in future. The other thing with COVID-19 is, why is it more dangerous than its SARS and the MERS? Is the SARS and the MERS, when they cause symptoms, it is so debilitating that the patient is almost bedridden. But with COVID-19, the symptoms are so mild that the patient tends to walk around, perform his daily chores, and tends to infect people around. So what is the message? The message is, since this virus can infect anyone, and result in transmission prior to the onset of symptoms, possibly even the individual even before developing symptoms. So what will happen? So what we need to do is, we need to be very aggressive in our testing and screening of the asymptomatic patients. What are the different intervention strategies which are being talked about? First and the foremost is preventive, and the second, of course, is therapeutic. Now, in the preventive methods, what has been reiterated and emphasized is hand washing. I think the most effective method to prevent the spread of COVID-19 is religious washing of hands. And this washing can be performed with simple soap and water. It is highly effective. You just don't need to run after sanitizers. The other is constantly sterilizing the various surfaces regularly touched by various individuals. The third is physical and social distancing and the use of face masks. The fourth is maintaining a good respiratory hygiene. And one must encourage the use of disposables and disposable tissue papers as wipes. Clothes should be cleaned regularly, should be washed, and should be exposed to sunlight for a minimum period of 2 hours. Get adequate sleep. Try remaining stress-free. Abstain from smoking and alcohol. Take diets which is rich in vitamin C, diets rich in fruits and vegetables. Now, certain myths which we really need to correct pertaining to COVID-19. One is taking hot baths does not prevent the coronavirus disease. The second is hand dryers are not effective in killing the virus, and so also the ultraviolet lamps. The third is the thermal scanners which are used to measure the skin temperature does not screen the coronavirus. And the fourth is the vaccine which are being used for pneumonia or H influenza does not provide adequate protection against the coronavirus. And the other thing is, you will find that these viruses keep mutating from time to time. That is why we've realized that the same vaccine which was effective last year may lose its efficacy for that particular virus the next year. So now, where are we with respect to the treatment? Whole range of medications which is being now studied, lot of clinical trials happening in the world around. Antivirals are being talked about, antimalarials are being talked about, and immunomodulators. Let's look at the antivirals. The drug which has shown a promising response has been remdesivir. Now, this drug was very effective in treatment of Ebola and the Marburg virus. It also showed some promising results in the lab and in the animal models for the SARS and the MERS viruses, but not in the human beings. Now, the initial data which has come from USA has been showing some promise of remdesivir in humans. It's probably able to alleviate some symptoms of the coronavirus and is able to reduce the viral load. But these are very initial results, so we must wait for more and more trials to come and answer this question. Hydrochloroquine. That is an antimalarial. It is an inexpensive drug, and India produces almost 70% of the world's hydrochloroquine. What is the rationale of using hydrochloroquine? We realize that the genome of this virus, the genetic makeup of this virus, has certain characteristics of malaria and HIV. There are around 35 ongoing clinical trials all over the world and in USA, and it hasn't shown much of an efficacy. The other thing that we are talking much in news is the plasma therapy. Now, this plasma therapy has been used in various viral infections like chickenpox, hepatitis, autoimmune disorders, and also in hemophilia. But what we need to remember is in plasma therapy, the efficacy of the therapy is very much dependent upon the quality of the antibodies which are being generated in a patient who is recovered from a COVID-19 infection. In other words, every individual who has suffered from COVID-19 may not have those good quality antibodies which can actually help in neutralizing this virus in another patient who's actually very sick. And that is the reason the plasma therapy, one has to screen the quality of the antibodies before actually giving it to the sick individuals. Now, a lot of talk about the vaccine. That's the most effective prevention preventive measure. A lot of people, a lot of scientists from all over the world are at it. But please remember, the fastest vaccine which has been made as of now has taken a duration of around 14 to 18 months. So we all need to wait patiently for this vaccine for COVID-19 to come in. So then what's the best strategy? There is no one solution. But it's high time for everyone to think globally and act locally to ensure that their intervention is relevant, is appropriate, latest, and right in action. So lockdown, isolation, aggressive screening and testing seems to be the need of the hour. So what is the lockdown aimed at? It aims at disrupting the chains of transmission, thereby reducing the number of infected cases. Please remember, lockdown is not going to eliminate the disease, but it's only going to disrupt the chains of transmission, and that is how we are going to keep a check on this particular disease. The other advantages of the lockdown is it will not overwhelm the healthcare system, and it will lower the curve of the spread of infection. So the COVID-19 crisis can bring forth in us the best, or it can bring the worst in all of us, or it can be both simultaneously. So with such clouds of uncertainty, with inadequate knowledge of the biological behavior of the virus, the best way to emerge out of this situation is to stay positive. I would again repeat Ghalib's poetry. हजारों उलझने राहों में और कोशिशें बेहिसाब, इसी का नाम है जिंदगी, चलते रहिए जनाब. So when things go wrong, as they sometimes will, when the road you are trudging seems all uphill, when the funds are low and the debts are high, and you want to smile, but you have to sigh, when all is pressing down a bit, rest if you must, but don't you quit. So stick to the fight when you are hardest hit. It's when things go wrong that you must not quit. That is a beautiful poetry which I quoted from John Greenleaf. And with this, I would love to conclude with my today's session. Thank you so much. Stay home, stay safe, be positive. This time too shall pass. Thank you.